Dr. DIna Kulik, pediatrician and founder of Kid Crew Medical, is joining us now. Doctor, good afternoon, and thank you for your time. We appreciate it.
You're welcome.
Talk to us about the concerns of the parents. What are parents telling you today when one of their kids, has fever, falls ill, and they don't have the medicine at the counter? What are you hearing?
It is very stressful for families when their child is uncomfortable, if they have fever, if they're not feeling their best, and they can't access the medication that they know would make their child feel better. So it's causing a lot of anxiety and stress for families in a stressful situation when their child is unwell. You want your kid to feel better.
You know, we are in the flu season, and of course, there is a possibility of this COVID-19 cases also coming back because we're heading towards the winter, going indoors. Talk to us about what is it that the parents can do right now if they do not have the medicine so easily available?
Yeah, so luckily what's going around mostly is viral illnesses, runny nose, cough, sometimes fevers, belly pain, stomach flu kind of symptoms. So keeping your child comfortable is really the biggest priority and the only thing we really can do because things like antibiotics don't help with viral infections. So making sure your child is hydrated. If they have less appetite, I'm not usually very worried about that, but we do want to make sure that they're drinking small amounts of fluid more often than typical. You can keep them comfortable with, more clothes or less clothes, depending on what they're feeling at that time. If your child is older, there's certainly other options in terms of medications. So a child may be able to take a chewable medication or even swallow or crush up a medication that would usually be used for adults. But I want to make sure that people know that they should always double check with their healthcare provider and pharmacist what is the best dose for their child based on the child's weight and any health conditions they may have. Once we figure out what they weigh, we can better counsel about the best dose for them. And that may be an adult medication in a smaller dose, but making sure that they're getting the best dose that would help them, but not a dose that could be toxic and therefore dangerous for them.
Dr. Kulik, of course, you're giving us options on what parents can do in terms of medications if the ones that the kids want is not available. But are there other ways of administering a medicine to kids?
Yeah, so different formulas. So for example, chewables or pills that you can crush. There are medications available like suppositories. So for younger babies, you can get a suppository from the pharmacy if that's accessible to you. But short of ibuprofen and acetaminophen types of medications, there aren't other medications that we recommend for fever and pain reduction in children.
You know, Dr. Kulik, we've been actually tracking this situation for a while. It's been happening for several weeks now that there is shortage of these over-the-counter medicines. And like we started off the discussion saying that we are in that time of the year where we are going to be seeing more flu cases, cold, cough, etc. Let me just ask you, in terms of preventing such a scenario, what's the best thing to do?
Avoiding people when they're sick. So I still definitely recommend that kids and adults stay home if they're unwell. We want to minimize how much we're passing these viruses to other people, keeping clean hands, keeping distance, not touching your face, as we've heard so much during the pandemic, and masking when appropriate to really provide that barrier from other people's germs towards your face.
Dr. DIna Kulik, pediatrician and founder of Kid Crew Medical, appreciate you joining us on the show, and thank you for all the suggestions and advice.
You're very welcome.